Hello, my name is Stephen Edwards and welcome to this week's video blog. We are going to take a look at what a clinic needs to consider as we get closer to the beginning of the year, any policies that need to be looked at or potentially changed. I'm doing this now so you can take what I discuss and what you feel needs to be considered and put all that together and get that out to your patients, caregivers, parents, before 12/1. And what that does, it gives them 30 days to be able to understand your policy changes, ask any questions, anything like that. I think that's just good customer service if you're going to change anything about your clinic to inform your patients and parents. So we'll just kind of go through a couple points real quick on considerations. If you haven't already enacted these, to enact them, consider it. Late fee charges. We do a lot of invoices for our patients and for our clinics. Many of you do have a late fee charge, and it is from anywhere from $10 to $25 to 18% of what the invoice is. And to EEP, it doesn't matter what that rate is as long as it's communicated with us. It's more that we understand, what your specifics are on when we charge that late fee. A lot of our clients do carte blanche. If it's late, if you haven't paid the first 30 days, have us send them the invoices and then they review and they put LF on it if they want to charge the late fee. We can do it any way that you want. If you do not have a policy, now would be a time to think, should I have a late fee policy on outstanding invoices? So that's my first one. Consider having a late fee. I think it's a little bit abnormal if you don't have a late fee, but I know many of you have a strong concentration of Medicaid, and obviously you cannot charge Medicaid or early steps recipients any kind of late fee because you can't charge them anything. So please be cognizant of that. This is only for common carrier insurances and their patients. Paying patient responsibility at time of service. If you're not collecting at your clinic at time of service, well, one, you should be. It's abnormal for a clinic not to collect from that patient at time of service. I know when I go to the doctor, if you try to leave or try to not pay that copay, the girl, Ruth, just about tackles you and to get that copay. She does not allow you out until you get that copay. And maybe you don't need to be so hard or what have you, but you need to make sure that you start posting those signs. It is customary for us to collect at time of service. And when you go into any doctor's office, that's what's on there. To the same effect, if you are not collecting copay, co-insurance, or deductibles, you're just kind of accepting what the common carrier insurance pays you. In my opinion, that is also not a good move. That would be abnormal in the industry. When I go to a specialist or my general practitioner, I expect to pay a copay, deductible, or co-insurance. So when they don't charge me that, that's a little weird. So if you don't collect that from a business standpoint, I feel that's a mistake. And I think from the patient's eyes, they probably question, why are they not charging me? So if that's something that your office doesn't do, and you're thinking you're being nice to the patients, well, you are. But from a business standpoint, that's probably not the best stance you could take, is not collecting the patient responsibility. And just so you know, it is against the Stark law. So you're literally breaking the law, not charging them. But again, you want to communicate if they haven't been paying that. You want to send them that documentation, that letter, come 12/1 and say, hey, as of 1/1, we're going to start charging these. When you are out of network with a common carrier insurance, you can collect your full rate from that family or that patient or parent. You do not have a contract with that common carrier. So If you did, you would only be able to collect coinsurance, copay, or deductible. But since you do not have a contract, let's say Blue Cross and Blue Shield, just because they're the most that don't let people in network. If you collect the full, let's say you want $100 per hour, you can collect that $100 per hour, especially if it's delay. Now you're going to get that day. You'll get $100. EEP will bill Blue Cross and Blue Shield for you, and if Blue Cross and Blue Shield comes through and pays, that's great. The person that should be in control of the money is, meaning you are the provider. You provided a service. You should be giving back money to the parent or patient, not after the fact telling the parents or the patient that they owe you $300 or $400 because it took 3 weeks to get the claim processed and they were seen once a week. Now, and it was $100 a week. Now they owe you $300 and they have an opportunity not to pay you. So if you collect at time of service the full amount that you expect to be paid, that's going to make you whole, and then you're in control of the money. So again, I suggest if you are out of network, you can collect your full rate up front when that person is in the window waiting to get services. If you are in network, you are not allowed to collect that whole amount. I know some clinics that do, and right or wrong, that's the fact. But they don't lose money to United Healthcare, to a patient when they have United Healthcare, and they're treated 2 times a week for 3 weeks before you get the EOB. It's developmental delay. Well, we know United Healthcare doesn't cover developmental delay, so now you have 6 dates of service that potentially that parent could just say, and a lot of them say, well, you didn't tell me it wasn't going to be covered, and they start that, and I've actually talked to a lot of parents that say, hey, the clinic did not tell me that this would not be covered. Well, one, you can't because you don't know, you're not an underwriter, but we need to set up our parents that, if it's delay and we send you a benefits that the delay is not covered, that you have that discussion with that parent. So when they do get a denial, it's somewhat expected. You'd be more apt to get paid if they expect that when you're in network. Again, when you're out of network, if I ran a clinic, I would be collecting at time of service and working it out after the insurance paid or denied. Another thing that I want to bring up are your self-pay rates. I can tell you that the rates in Florida, and Florida's big, range anywhere from $35 to $70 for a half an hour of therapy, and $60 to $120 for an hour of therapy. So, if you're going to raise your rates, you definitely want to get with and give your clients, your patients and parents a heads up that you're going to be raising your rates, because that could have a profound impact on your patients. So take a look at what clinics in your geographical area are doing, and consider raising your rates. Your expenses have gone up, I can tell you, and there's pressure on your reimbursements. So you definitely need to take a look at your self-pay rates. And I know that a lot of you are trying to build your self-pay cases, get more self-pay people in. I can tell you, if your rates are too low, you will have a lot of patients. But that doesn't mean you're making money and you're able to pay your clinic, you're able to pay your therapist, and be able to pay all that administrative items that have to be paid out of a clinic. So you really want to take a look at, how many self-pay people do you have? What is the normal amount that you bring in a month with self-pay? And if you should increase, $5 a half an hour, I think that's minimal. Especially if you're at the 35. If you're at $35 for a half an hour, in my opinion, you should be raising that really without question. And that doesn't mean that you can't, give this family that has 3 kids and all 3 are in therapy a special deal. You run the clinic, you can do that kind of stuff. I'm talking in the general sense, that self-pay rate that I know many of you have. I really won't go into the Stark Law and the the fact that a sliding scale should be implemented and all that, because I know that not all doctors and stuff do that. If you want to talk to me about that, let's have a discussion about the Stark Law and the sliding scale. But for this presentation, you need to really take a look at your self-pay rates, because most of you just have self-pay rates that patient pays for that half an hour of therapy. So I hope I've at least started a dialogue between yourself and your administration team, so you can take a look at what potentially could change at the first of the year, and that what we need to communicate to our patients and parents. Now, next week on the video blog, we're going to be talking about kind of the preparation from a HIPAA handout, a financial affidavit that you would want to get, like all your new patient paperwork and updating your records, a newness in relation to the beginning of the year. So have a good weekend, and I appreciate it, and you have a good day.